Good evening to all the viewers who are watching live. Thanks for joining us while watching live, as it's the final World Cup final going on. And amidst that, you're joining live. That means a lot to us. Oh. So without wasting any more time, let's just jump with our 30 seconds countdown time. And yes, this CME 2 is going to be on YouTube only. The others means what to say, the other platforms are having some technical difficulties, so it can't be done over there. Please pardon us. And the e-participation certificate link will be on soon. So let's start with the 30 seconds countdown time.
Good evening, everybody.
Good
Good evening,
evening.
sir.
Very good evening.
Wishing everybody our Vijaya Pranam after Durga Puja festival. All our well wishes for Diwali and respect to all the viewers, our seniors, juniors, and everybody across the globe. Now, slowly and steadily, we are inching towards our centenary CME, but tonight we'll be hosting our 83rd live continued medical education program. And in spite of the high voltage World Cup final in cricket at Narendra Modi Stadium, Ahmedabad, still the lovers of homeopathy, the followers of homeopathy, the passionate crusaders of homeopathy are here tonight to continue with the CME. And sir, over to you.
Thank you. Very much welcome in that 83rd CME. It's a great and grand opportunity for all of us, all the alumni, to meet each other and to listen to others. And at the same time, we are gradually reaching our experiences and knowledges to others. So today we will have a separate field of homeopathic system of management as it was expressed by Hahnemann, one of the essential part of treatment that will be nicely uh, nicely expressed by our experienced person. Those we have seen all along, he was very much interested in physical medicine. Rupak Biswas, Dr. Rupak Biswas, he will demonstrate nicely. So anyway,
Uh, So, with
let
your
us call
permission,
our
let us call our
sure,
inaugurator tonight,
Dr.
Dr. Rajiv, to inaugurate tonight's program. And Dr. Rajiv is here in the studio now. He had been a great orator and speaker during the COVID period with his technical knowledge, and we would be honored to request Dr. Rajiv to inaugurate tonight's CME. Dr. Rajiv Sarkar, Orko, right. Over to you, Dr. Rajiv.
Thank you, Bidyut. Thank you, Dr. Kalyani, sir. I think this is really honor for me to introduce today's speaker, Dr. Rupak Biswas. Rupak, as we know him, he is a third batch BHMS students from NIH, and then he did his MD homeopathy from Dr. Bhimrao Ambedkar University in Agra. Dr. Rupak Biswas also was previously attached with the Department of Yoga and Physiotherapy at the National Institute of Homeopathy.
Rajiv sir, your mic has been muted, sir, for like couple of minutes. Hello, sir. Your mic has been muted. Hello, sir. Your mic has been muted, sir. Hello, hello, hello. Hello, Rajiv sir. Your mic has been muted, sir. Um. Okay. For some reasons, sir has been cut out. Please handle all from here.
Can you hear
Rajiv
me?
sir is in.
Yes.
Can you
Over
hear
to you,
me?
Rajiv.
Mhm. Now
Biduta,
it's
can
Yeah,
you
all
hear
right, sir.
me?
yeah, you are audible now. Rajiv, technical error, Rajiv. Again, no sound. We'll wait for Rajiv. We will be waiting for Rajiv for a few
Let
minutes.
us wait.
He is trying to get connected. Dr. Rajiv Sarkar has been attached with community medicine, and he is an associate professor of community medicine in Shillong. Uh, I have to go through the details. Also, did we get Rajiv in?
Hello.
I think they have joined. Yeah, yeah, you are audible now. For me, few minutes you are muted,
Hello.
Rajiv. And now you are audible. Dr. Sokar, you are audible now. Check your check your mic.
Hello.
You are audible now. You were muted before. Now it is audible. Carry on. There is some error is continuing.
Rajiv is trying to get connected, but is failing.
There is some error, I think. Let us wait for a while.
Yes, sir. Let's just wait for them. Maybe
Let us
their
wait.
technical difficulties are going on. For that
Sure.
reason, it's an issue. Viewers, please bear with us few moments. I mean, few minutes. Mm,
These are our occasional constants, but alumni association is still proceeding, ignoring these constants.
Let us call on Dr. Rupak Biswas. Kalyani sir, let us call on Dr. Rupak Biswas. Before that, I'll request Dr. Dhanalakshmi to be on screen. And over to you for the show, Dr. Dhanalakshmi, the
Rajiv has
moderator
joined.
tonight.
Rajiv, are you audible to you?
Rajiv has joined again.
Hello, can you
Rajiv,
hear me
are we
now?
audible to you? Yeah, you are audible.
Okay, yes, I think, sir, some problem happened with my mic.
Definitely.
So, shall I? You are not able to hear me, no? Last time, Viduda?
Yes, yes. Now you are audible. Please carry on.
Okay. Okay, Viduda, thank you very much for this opportunity. And to everybody, welcome to this webinar, which the NIH Alumni Association has been organizing for some time now. It is my great pleasure to introduce Dr. Rupak Biswas, who is a NIH alumni. He is third batch BHMS student, uh, and he is also a renowned yoga practitioner. He was attached to the National Institute of Homoeopathy in the Yoga and Physiotherapy department, and he is also currently a medical officer at the Bagula Rural Hospital. He is Rupokda is a national level judge of Yoga Welfare and Sports Association and has attended several competitions and television program. He has also written many books, which are very popular in the market. I think without much ado, without wasting further time, I would really like to welcome Dr. Rupak Biswas for this CME. Thank you.
Orko কি হলো?
Major technical difficulties from both ends of speaker and also from other people's. Just wait for the constraints. Yes, Dr. Rubok Viswas is in.
Okay.
So, what do you? Rubok sir, please start, sir.
Good evening to everybody. My regards to our respected sir, Dr. Debnaran Kalyani, President of NIH Alumni Association, and Dr. Bidyut Mukherjee, Secretary of NIH Alumni Association. Thanks to Moderator Dr. B. Dhanalakshmi and Inaugurator Dr. Rajiv Sarkar. Myself, Dr. Rupak Biswas, MO, RBSK, alumni and ex-employee in Yoga and Physiotherapy Unit of NIH from 2003 to 2013. I am very much glad to get the opportunity to be the speaker for today's 83rd online CME session organized by National Institute of Homeopathy Alumni Association. Today's topic is importance of non-medicinal management and exercise in cervical spondylosis. Non-medicinal management is very important in the treatment of cervical spondylosis. We have to remember a correct medicine is not enough for the treatment of cervical spondylosis because if we prescribe a suitable medicine for a cervical spondylosis patient without non-medicinal management, then patient may not get enough relief. Not only that, pain or other complaint may increase. Non-medicinal management is so important that in some case only non-medicinal management is enough to control cervical spondylosis. To know non-medicinal management of cervical spondylosis, first we have to know about the disease, especially its etiology. What is cervical spondylosis? Degeneration of the intervertebral disc and spine in the cervical spine is as cervical spondylosis. Etiology of cervical spondylosis is degeneration of intervertebral disc and spine in the cervical region. The degeneration is an aging process in elderly person, and in young age group, degeneration is due to overstrain in cervical spine, that is, heavy weight carrying in hand or head, working for long time in for bending of neck. Degenerative change is very common between C6 and C5 vertebra because mobility is more over here in our daily works. Now look at the difference between normal cervical vertebra and cervical spondylosis affected vertebra. In this image, the gap Mm. In this image, this is a normal cervical vertebra. The gap between the vertebra is normal. Vertebra body and spine is normal. There is no degenerative change like osteophyte or lipping formation. Next, now this is a cervical spondylosis image. In this image, look that gap between vertebra is reduced. Bony spar or osteophyte is there. Sign and symptom of cervical spondylosis: neck pain, stiffness in neck, sometimes radiating pain or weakness in arm. Now, what are the non-medicinal management for cervical spondylosis? Number one, correct posture care. Number two, hot and cold compression. Number three, cervical pillow. Number four, cervical collar. Number five, exit. Number seven, subtraction. Number eight, diet. How to know correct and sex. Number one, use of high pillow, figure 3. Number two, lie on neck bending position, figure 4. Staying in neck bend position, work with neck bending position. Maybe in head or hand, figure 6. Now, these are all correct posture. Number one, use normal pillow. Number two, lie in that position so that neck do not bend much. Read in high table so that neck do not bend much. Minimum bending of neck. Number 5, do not carry part by part so that over pressure cannot affect cervical spine. Always spine and head straight. Use firm mattress. Number 2, hot and cold compression. Hot application. Hot application is very effective in any type of chronic pain. Hot application reduces pain due to sedation of heat on nerve and irritation of the nerve. Heat causes vasodilatation for the muscle, thus reduce muscle and muscle action. Sweat glands activity increase due to heat. So during hot application, sweating occurs and thus increase elimination of waste product. Type of hot application: A. Dry heat, hot pad, electric hot pad, hot water bag, etc. B. Moist heat procedure: take hot water and soak towel, then squeeze it and apply on the affected part until the towel become cold. Then again soak it in hot water and apply for minimum 10 minutes, 2 to 3 times in a day. Moist heat is more effective than dry heat because penetration power of moist heat is more than dry heat. Cold application. Cold application causes vasoconstriction, thus reduce pain, swelling, and muscle spasm. Ice or ice cold water is applied on the affected part. Contrast bath. Contrast bath reduce pain, stiffness, and swelling. Procedure: take two containers, one containing warm and another containing cold water. First, soak a piece of cloth in containing container containing warm water and then squeeze it and apply on affected part for 1 minute. Then immediately soak another cloth in cold water. Then squeeze it and apply for 1 minute in the affected part. Do it alternately for 10 minutes, 2 times in a day, morning and evening. Contrast path is very effective where stiffness is more. Number 3, cervical pillow. Use low pillow, never use high pillow, but use of cervical pillow is more comfortable for the support of neck. Figure 7, cervical pillow. Figure cervical pillow. Figure number 7. Simple round soft pillow, 5-inch diameter and 18-inch long, can be used as cervical pillow. During supine position, pillow may be used or may not be used, but on lying on side, right or left, must use pillow. If not, pain may increase. Now, Dole will demonstrate how to use this pillow. Simple round soft pillow, 5-inch diameter and 18-inch long. The pillow must be kept below the neck, not below the head. This is very effective for cervical spondylosis. Number 4, cervical collar. Cervical collar reduce pain and spasm of neck muscle. Figure 8. Cervical collar. Now, Dole will demonstrate how to use cervical collar. This is cervical collar. Number 5, exercise. During exercise, head and spine should be in straight position. Dole will now demonstrate the exercise. A. Static neck exercise. Press right side of your head with right palm. Keep your head in a straight position for 5 seconds. Repeat the same on the left. Then keep both the palm below the mandible and press upwards for 5 seconds. Then keep both the palm on the forehead and press backward for 5 seconds. Keep both the palm back of the head and press for 5 seconds. Repeat the same 4 times at a time, minimum 3 times in a day, morning, evening and night. Next, shoulder shrugging exercise. B. Stand straight with 1 foot gap between 2 feet. Keep both hands close to the body. Raise both shoulders up while inhaling and bring both shoulders down with exhalation. Thus repeat 30 to 40 times. Do this exercise 2 to 3 times in a day, morning, evening and at night. 2 to 3 kg weight can be taken in each hand during this exercise for better result. This is known as resistive exercise. This exercise helps to develop trapezius, levator scapula, rhomboid major and rhomboid minor muscles, which helps to relieve suffering. Number 6, yoga. Yoga strengthens the neck muscles, increase blood supply in the muscles. Thus, yoga helps a lot for cervical spondylosis. Now, Dole will demonstrate the two most important yoga. A. Bhujangasana. Lie on the floor with the face downwards. Keep the palm on the ground underneath the shoulder. Slowly raise the head, trunk and spine backwards. Navel to toe must touch ground. Normal breath. Hold this position for 10 to 15 seconds and then bring the head to its normal position. Repeat this asana 3 times morning, evening and night. B. Ardhachakrasana. Stand straight with 1 feet gap between two legs. Stand straight with 1 feet gap between two legs. Keep your both hands on waist. Bend backward from lumbar region. Neck bends backwards, stretching the muscles of the neck. Inhale while bending, then breathe normally. Okay, thank you, Dol. Number 7, cervical traction. Cervical traction is advised to the patient who are suffering from cervical spondylosis, especially when degenerative changes are in lower cervical region, that is C5, C6 and C6, C7. During cervical traction, spine must be straight and neck should be 10 degrees in extended position. Figure 9, cervical traction. Figure 9, cervical traction. Weight 1/7 to 1/10 of the body weight, usually 7.5 pound in lean thin person to 10 pound in fatty person. Time 15 to 30 minutes, 1 or 2 times morning and evening in a day, for 7 to 10 days or more according to suffering. Benefit of cervical traction: it reduces pain, tenderness and muscle spasm, helps to increase mobility of joint, relieves pressure to the compressed cord and nerve root. Traction help to increase nutrition of the surrounding bones, muscles and tendons. Number 8, diet. Diet play a very important role for control of cervical spondylosis. As it is caused by degenerative change, we should have calcium-rich food. Calcium-rich food are milk, curd, guava, fish and leafy vegetables, etc. Our body cannot prepare calcium. We must get it from nature. For absorption of calcium, body needs vitamin D3. We can get it from exposure to sunlight, preferably morning sunlight for 1 hour. Non-medicinal management is very essential for treatment of cervical spondylosis, but all types of non-medicinal management is not essential for all cervical spondylosis patients, especially exercise, yoga, and cervical traction. For exercise, yoga, and cervical traction, experts' opinion required. Some clinical tips for cervical spondylosis. Homeopathic treatment must be done depending on totality of symptoms, but there are some important or red line symptoms which helps in the treatment of cervical spondylosis. These are number one, rastux, pain and hotness relieved by motion, aggravate during rest. Ruta graveolens, pain due to overstrain and stiffness is more. 3. Hypericum, constant tingling pain in relieved by hot application. Number 4. Calmia latifolia, and 5. Thirst is more. Number 6. Causticum, heaviness and weakness, numbness in hand. Number 7. Nephilium, numbness alternate with pain. That's all. Thank you. Over to moderator D. Dhanalakshmi.
Am I audible?
বুঝেছো হিরো রাজা হয়েছে নিজেই স্টেডিয়াম ভাঙবে
Yes.
Can I proceed or go? Can I proceed?
Yes,
Okay. Am I audible? Am I audible?
yes.
Okay. Thank you, Rupak, Dr. Rupak Biswas, for such a elaborate presentation on ergonomics. Actually, I would say it is so wonderful that he started with the causes and then proceeded with some picture representation. And I should thank Doll for doing such a wonderful asanas here. Thank you so much. It was wonderful that you showed so many pictures to explain, and then you explained the pathophysiology. What happens if you give a moist compress, then a dry compress, dry heat, and also you told about the importance of a lifestyle. You have indicated medicines. It's a total complete presentation. I would say, and we all know that. Am I audible? Argo? Argo? Bidyut,
Yes,
am
ma'am.
I
You're audible, ma'am. Yes,
okay? Can
ma'am.
we
You're
continue?
audible.
Can we continue?
Yes, ma'am. Yes, ma'am. Sure, ma'am.
Yeah.
You are
Yeah,
clearly
that's all.
audible.
Hope I was quite audible all throughout. I was trying to thank Dr. Rupak Vishwas. He's my classmate, and I have known him from college days. He was an ardent yoga practitioner, yoga asana practitioner. He was a wonderful person who can do sirasasana for minutes. I don't know how long he can do now. And he was a wonderful person who can do yoga, and he's the right person. Thank you, Bilda and Dr. Kalyani sir, for choosing him for this topic. And uh, we all know that cervical spondylosis is one of the most important and most prevalent lifestyle disorders these days, because we are using these laptops and mobiles, which is and two-wheeler riding, and I should say even our mobiles are being a cause for our cervical spondylosis, right? Hope you people agree with that. And with this, every day we are causing a damage to the cervical spine. And Dr. Rupak has clearly shown how damages are happening in the spinal level, how spaces are getting reduced, how it is becoming symptomatic. And he also has given suggestions in the management portion, doing asanas and using pillows, and also other exercises which he showed bhujangasana, and then one more asana. I'm not very conversant with all those terminologies, but it was wonderful to see him. His daughter also, his daughter Doll, Miss Doll, she has demonstrated yoga so well for us. And yoga is handy when we have to handle cervical spondylosis, because the damages which is happening because of using the laptops and mobile phones can be corrected every day by those gentle movements. In Jubma Hospital, they have devised a pose called of the cat pose. I don't know. I think Rupa can add upon that. Mari Juasan, something like that. That cat pose lubricates entire spine from the cervical spine to the lumbar region. I think he can demonstrate, or he can throw some more light on that. That posture I heard they have suggested for the beginners, no, who does not practice yogasan, and this asan and lubricates entire spine. They bend like convexly inward, and then they convexly bend backwards, so that way the entire spine convexes, bends up and out. So this really helps in lubrication. I think Rupa can throw some light on that. And yes, it was wonderful. He had suggested nephalem, he had suggested ruta, he had suggested rustrux, but I would say that arnica should be the first remedy because it is a man-made disaster, I should say. It is a man-made disease. So thank you so much, Dr. Rupak, and thank you for this wonderful opportunity, respected Dr. Kalyani sir, and respected Bidyut, my senior. And thank you. Hope I do we have any questions? Do we have any questions in the for the speaker, please? We'll be happy if you can have any questions. now hand it over to you. Bidyut, you're there? Arko? Are we still going live? Okay. Thank you. Then we hand over the mic to Dr. Kalyani sir, our respected Dr. Kalyani sir, to conclude the session.
Thank you. Many thanks from core of our heart to our moderator, Dr. B. Dhanalakshmi, for coming with us from a long distance. We are really thankful to you. And equally, many thanks to our inaugurator, Dr. Rajiv Sarkar, for giving beautiful inauguration. And nothing to say about Dr. Rupak Biswas. He is all along working with this subject, physical medicine. He is expert. We have seen it in our OPD, IPD. And today we have seen a new thing, that he is making our daughter expert in this line. Many thanks, Rupak, and your daughter. Really, we are very much happy. Once we see that our sons and children are coming forward to help us, to help homeopathic system medicine, we feel really great. So they are successful. Like all son of Dr. Bidyut Mukherjee, your daughter. Anyway, beautiful, simultaneously. Father and daughter, father and son is working together for betterment of the system of medicine for the humanity. Anyway, before going to a broader aspect, let me add two drugs very commonly used in this type of spondylosis. Usually we find spondylosis in the early stage, infrequent pain in neck. If you find that this pain, automatically this goes off. Either whether you give hot application or you give rest, that goes off automatically within few hours to few days. But sometimes it lasts for long because of the professional hazards. He is not able to keep his cervical spine in anatomical position for long period due to profession. That time, persisting strain or recurrence of pain frequently without tingling in the hands, that means there is no compression, nerve compression. There is a very nice drug called as lactansis. You can try of it. That can arrest in the early stage and will make the patient alert that I have to do something, otherwise I have to suffer. So lactansis is very nice drug for torticollis, heavy spasm of muscles called as torticollis. That you can try and you can have experience. Another drug is a very dangerous drug for a dangerous complaint. When you find a severe pain, agonizing pain, patient is tossing about, not getting relief by homeopathic common medicine, neither by painkiller, not by traction, not by any means. At least you once should try with thallium. It's a fantastic drug. You study from Boric Mathematica that emergency or severe condition when patient needs to the hospital is such a case. whether it radiates up to the head, up to the hands or back, or only in the neck. Healing with a beautiful drug for serious complaints of cervical spondylosis. Anyway, there are many other drugs, as we know that from aconite to zincum, abrotinum to zincum, or Avis nigra to zincum, any drug can come for spondylosis according to the symptoms. But as we have learned that first by Hahnemann, that at least we have to first palliate. If we cannot come to the conclusion, give some short drugs to palliate. Beforehand, you take the ACC, make your drugs ready for prescription, then you can palliate for this some time to get confidence of the patient. This is about little bit regarding clinical, but what we want to tell our is that it is a history that Hahnemann, long back, before foundation of WHO, World Health Organization, says that cure means restoration of sick to health. Sometimes it happens that the sayings of great men, to understand the saying of great men, world needs sometimes centuries of centuries to understand the words. I will tell you how the world is realizing the word restoration of health by Hahnemann long back. If you find the history, that you will see that the world was very much busy before Hahnemann regarding restoration of health, how to keep the patient fit, how to cure, how to give relief of the patient, as we called as restoration of all. Whole world was busy. Now, while we are all restoring the health, we found that there are many diseases which are coming, which become very difficult to restore if it is not being arrested, if it is not being controlled, like smallpox. There are many other diseases, contagious diseases, or portable carriable diseases. Then the world understood, and it was announced by WHO that medical systems should develop the process of prevention of the disease. So first we are busy with the restoration of health. Now came prevention of health. We should prevent the persons to become sick, like smallpox, as we have seen in COVID-19, many other diseases. World has experienced that yes, prevention is good to reduce the number of suffering and to assist the prevention system a lot. If we can prevent the diseases, many hazards can be avoided by the restorating system. And cost effectiveness of the restoration is very high, whereas prevention is much less. Now, recently, I am telling that when we were a student, we never heard of this promotion of health. But nowadays, we are finding that whole world has become busy with promotion of health. We have to promote our body not to become sick. Even if we are exposed to diseases, our defense system, immunity, and all other anatomical system, physiological organs systems will be such in a strong state that they will be able to prevent infections and other diseases, contagious or non-contagious diseases. This promotion system is gradually growing throughout the world. You'll be happy to know, Rupak knows very well, much more than me, that nowadays whole world, including the highest economic status countries, they are gradually tilting towards yoga and trying to keep their health alert, healthy, much before infection or any other disease to come. So see the Hahnemann's view that a restoration of sick, not only we are responsible to cure the patient, but we have to advise the patient how to restore his health. Nowadays, the whole world, because economically every one of us are improving ourselves, we are purchasing sickness. Every day, we are purchasing. We are purchasing costly bed to lie, to sleep comfortably, but purchasing spondylosis, arthritis. We are purchasing fat foods, preservant foods. We are inviting liver disease, gastric disorder, intestinal disorder, many other things. We are maintaining the air conditions. Many times we are staying in the air condition, purchasing many type of diseases due to exposure to cold. By this way, by our lifestyle, our profession, we are handling mobile too much, we are purchasing cervical spondylosis. Likewise, many diseases nowadays people are purchasing. That's why what I say, that there are a number of people who are educated fools. Excuse me for this version. You are much educated, definitely. But we are fools regarding our health. We do not know. We are not aware of keeping our health normally. So in this regard, Repok's contribution is beautiful, that all of us should be very alert, not only by curing the patient, but also we should learn how to prevent. We should learn how to preserve, prevent, and promote. Because to promote health, to promote physiology, to promote anatomy, almost it is costless. Doesn't need a single farthing. If we are alert, if we go on practicing ourselves, free hand exercise, especially yoga, pranayams, we are able to keep our body healthy. We'll be much away from infection and other diseases. So, brothers and sisters, nowadays we should be very, very cautious, as Rupak was guiding us, not only regarding the spine, but also whole spine, lumbar, cervical, dorsal, all spines, joints, muscles, heart, lungs, intestine, brain. Regarding all the systems, we are physiology, anatomy, we should exercise by different means to keep them healthy, to develop their natural preventive system. You might be knowing that every system and their physiology, 75% of their capabilities are reserved. As we have seen, 5 liters of blood in our body, but only 1.5 liters is circulating. Rest is reserved for emergency. Our muscles are contracting, relaxing. Only 20% is working. 70% is reserved for strain and stresses. Like this way, heart, lungs, brain, every system, every organ, rather every tissue, they have kept reserve capacities 75% approximately. Only 25% are working. What happens? We do not practice to keep our health alert, keep our body healthy. Then that 70% remain idle, not effective for a long, long period. When emergency comes, body is not experienced to use that 75% residual capacity, and we become suddenly sick. It takes a long time to recover. That's why to exercise gives that residual 70% of respiration, heart, lungs, muscle, all the physiology and anatomy. We should practice physical medicine, that means physiotherapy, means exercise, yoga, and such. So our responsibility to keep ourselves healthy for the sake of our patients, and to create interest among our patients in hospital and private, that after getting cured, you should be alert regarding your health. Go on doing this exercise practicing to different sufferings. So the world is very much interested nowadays to promote health. And long back, as I was stating, animal advised us. Now the world is realizing that what does the word means, restoration of health. Anyway, thank you very much for coming with us. Those who are in on the screen and with me, we will return. Many, many thanks. All of us are very much encouraged by seeing each of us and contributing our experiences. Please come forward with experiences. Especially Dhanalakshmi, you come as a speaker one day with your experiences.
Sure,
Yes,
sir.
all of us. I don't believe that even a single innate, whatever minimum quality or efficiency he is having, he don't have any experience. He has many experiences that he is not sharing with others. Boldly come forward. Mistakes is coming to everyone. The more you will work, the more mistakes will come up. So please come forward, encourage us, and contribute what you have experienced. Thank you very much.
Thank you,
Thank
sir.
you. Thank
It's a
you.
thank you.
Thank you.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And with this, thanks for watching again. And if you want the e-participation certificate, it's the link is given in the description below. Go over there, just click on that. The The link will be open till tomorrow's 8 p.m. So you have very few chances. So go now, take on the auto generated certificate for yourself. And with this, thanks for watching again. We will meet you in our next CME. Until then, it's me or Mukherjee leaving out.